Hi friends, welcome all of you to the class of adrenal gland and its disorders. Before we start, we need to understand briefly about how these glands make hormones. For that, it is better to look into the flow chart which I prepared, like this one, for your easy understanding. I think everybody knows about pituitary gland. Pituitary gland is a small pea-shaped a pea-sized gland located at the base of our brain below our hypothalamus. It's a part of our endocrine system and is in charge of making several essential hormones. And this pituitary gland is divided into two lobes. One is the anterior pituitary lobe and the posterior pituitary lobe. This anterior lobe make and release hormones like TSH, ACTH, FSH, LH, prolactin, growth hormone, like that. Then the posterior lobe of pituitary gland stores and release hormones like ADH and oxytocin. These hormones stimulate the organs and produce secretions. As our topic is adrenal gland, I am going to talk about adrenal gland. Adrenal glands, they are the two small organs that sit on top of each kidney. Adrenal glands make different types of hormones. They are like cortisol, aldosterone, then the epinephrine, norepinephrine. These all are the hormones this adrenal gland secretes. See, this cortisol is the major hormone that I am going to discuss in this chapter. See, when you have adrenal gland disorder, your body makes too much or little of one or more hormones. So now I am going to in detail about the cortisol hormone, cortisol excess and cortisol deficiency. So that we will discuss now. So when we have to talk about cortisol, we need to know from where this cortisol comes from. This adrenal gland has two parts, the cortex and medulla. Cortex secretes cortisol, aldosterone, and medulla secretes epinephrine, norepinephrine. And this cortisol, no, they are the steroid hormone. They are essential, especially in stress and for maintenance of BP and gluconeogenesis. For these are the functions of cortisol. Let's see what will happen when there is an increase in the cortisol secretion. This disease is called as Cushing's syndrome. They are cortisol excess, that is glucocorticoid excess. This is also known as hyperadenocorticism. Then what will happen when there is an increase in the cortisol secretion? In such case, patient will be having a round moon face due to the muscle wasting and accumulation of fat. Then the surface capillaries in the face and other skin regions become fragile and readily susceptible to hemostasis and after mild trauma. Then the facial skin will be a ruddy color. Then hirsutism is the one of the other major symptom of this Cushing syndrome patients, that is the unwanted male pattern hair growth on the woman's face, chest and back. Then what will happen is delayed growth and development, especially skeletal and dental structures. Then many of these findings similar to patients with moderate to high dose glucocorticoid therapy, and these patients are considered to be immunocompromised. So when we consider this patient as immunocompromised, we need to be careful when they come for any dental treatment or any thing like that. So what will be the dental management, as they are susceptible to infection, because we consider them as a immunocompromised patients, so they are susceptible to infections. Then antibiotic coverage for the dentoalveolar infections or any surgery. Then we know this cortisol, the function of cortisol is that is essential especially in case of stress. So what will happen when cortisol production increases, the stress also increase in such patients. So when they come for the dental treatment, we need to assess properly about their ability to withstand the stress. So that is the oral manifestation of the cortisol excess, and moreover alveolar bone loss is also the other symptoms, so that lead to osteoporosis of the jaw. So then what will happen is that when osteoporosis of jaw is the problem, then the tooth loss, periodontal disease and all the other problems comes. Then buffalo hump is also the other symptom. Then hypertension, stretch marks, these all can be seen in cortisol excess patients. Then we will talk about the adrenal insufficiency. We will see what will happen if the production of cortisol is very less. In such, that disease is also known as Addison's disease, hypoadrenocorticism, glucocorticoid therapy. These all are the other names of adrenal insufficiency. So what will happen in such cases? This leads to the loss of appetite, weight loss, low energy, hypotension. So in a stressful situation, cardiovascular collapse can be seen, and that can lead to death. Then loss of pituitary function. Then the other major symptom of this Addison disease patient is the hyperpigmentation. So that can be seen when we see about the oral manifestation. We can see that their oral pigmentation is like the important area that to be assessed. Oral pigmentation in oral cavity, how it would be like? They are like the irregular spots that range from pale brown to gray or black color. So you when you go and see the thumbnail, you can see that one picture of the highly pigmented mouth. That is the Addison's disease case. So the oral pigmentation is an important factor that we need to assess. Then the dental management of such patients are similar to the immunocompromised patient, because they are also considered as the immunocompromised patients. So what all are the signs and symptoms of immunocompression? They are the oral candidiasis, recurrent herpes labialis, herpes zoster, gingival and periodontal disease, impaired wound healing. These all can be seen as the oral signs and symptoms of immunocompression. So we need to look into that. So this is all about a short class of Cushing syndrome and Addison disease. Then we need to discuss one question which was asked in AFK. That is, the patient complained of irritability, fatigue, weakness. She is losing weight and has diarrhea. Weight loss is a major symptom of Addison's disease. This is the answer is Addison disease. And clinical examination is diffuse brown macular pigmentation of oral mucosa. As I mentioned you earlier, that the oral pigmentation is really an important assessment factor. So this diffuse brown macular pigmentation of oral mucosa, that can be seen. So the answer is Addison disease. Only one question is asked in AFK question, so that's why I incorporated that into this. If you want little more detail about this topic, you can inform me in the comment section. Thank you.